Medicine and Rehabilitation, Emergency Medicine, Respiratory Medicine Department. These departments were removed by the National Medical Commission from the undergraduate medical curriculum or MBBS curriculum. This is what we are discussing in today's episode of Straight Up by edX Live with me, Harsha, Tallapragada. Doctors groups and student groups are worried about the new decision of NMC. On August 16th, NMC published the revised MBBS curriculum regulation, which did not include departments like the Respiratory Medicine, Physical Medicine and Rehabilitation, and Emergency Medicine under the mandatory list. To look back, NMC's original draft of minimum standard requirements for establishment of new medical colleges, increase of seats in MBBS course regulation, 2023 mentioned a list of 24 mandatory departments in the medical colleges. However, the final version listed only 21 departments. Worried and upset with this, doctor groups and medical students are urging the Union Health Minister, Mansukh Mandavia, to reconsider their move. Calling NMC's decision to remove the respiratory department as a retrograde step, Tamil Nadu Medical Students Association President Dr. Kirti Vardman speaks. Listen in.
Particularly speaking about this respiratory medicine department, we all, even a common public, know the important diseases of respiratory system. For example, everyone are aware of pneumonia, everyone are aware of TB, and how consequences the India faced because of TB. What are all the things we overcome because of TB? And we all know the impact of smoking and COPD, bronchial asthma, as well as bronchiolitis, as well as respiratory infections, as well as we all know the drastic effect of lung cancer. So smoking and lung cancer and relation, even a common public know about this. So every MBBS students should know about these subjects. So as well as emergency medicine, tackling the emergency is again an important job of an MBBS doctor to know during this curriculum. So removing these important subjects, and purposefully NMC is adding Ayush, that is Ayurveda, Siddha, Unani, and this Ayush to be compulsory or mandatory during a week posting in a internship is again making the concept of mixopathy in medicine. It is like mixing the traditional medicine and modern medicine, and they're confusing the students by this, and this will make confusion in future also. And we, Tamil Nadu Medical Student Association, are opposing this, and we oppose NMC in many of the aspects. Like we oppose the NEET because it's again state autonomy. We oppose the next exam because it's again state university autonomy. Then we oppose district residency program, which was implemented by NMC this year.
Further, the association is also thinking about staging a protest against such non-beneficial measures, the president adds. Adding more to this, the National Vice President and Chairman of the United Doctors Front Association, Dr. Lakshya Mittal, reacts to the removal of the three departments.
I think, according to me, it's a retrograde step of NMC. As we all know, in the pandemic, there is a major role of respiratory medicine and emergency medicine branch, which really helps a lot of patients in tackling the pandemic. As physical medicine being an exclusive branch for the Divyangan patients, it's really disappointing that removal of this branch. How we gonna tackle the TB, that is by 2025 the target under the National Tuberculosis Elimination Program, by not having the respiratory medicine specialists, as well as it's a retrograde step. And I urge the government and NMC to kindly please reinstate these three major branches again in the draft, so that it will also help the patients from a disastrous state, as well as the students, their education, their knowledge, that is must for a MBBS graduate to have all these departments exposure.
We leave you with that. Stay tuned to edX Live and don't forget to like, share and subscribe.